Good afternoon. Welcome back to the ZOHU call. The webinar will begin soon. Please stand by. Good afternoon. I'm Keisha Bohannon, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, I'm pleased to welcome you to this Zoonoses and One Health Updates call on August 7th, 2024. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material, as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/1-health/PHP/training-events/August-2024-ZOHU-call.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1, identify an implication for human, animal, and environmental health. 2, identify a One Health approach strategy for prevention of public health threats. 3, identify a One Health approach strategy for detection of public health threats. 4, identify a One Health approach strategy for responding to public health threats. 5, list 2 ways to improve collaborative practice across the public health care team. Next slide, please. In compliance with continuing education requirements, all planners and presenters must disclose all financial relationships in any amount with ineligible companies over the previous 24 months, as well as any use of unlabeled products or products under investigational use. CDC, our planners and presenters wish to disclose they have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Content will not include any discussion of the unlabeled use of a product or a product under investigational use, with the exception of Dr. Stephen Cole's discussion. Dr. Cole will be discussing extra-label antimicrobial use. CDC did not accept commercial or in-kind support for this continuing education activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/1-health/php/zohu/index.html. To receive free CE for today's webcast, sign in or create an account at train.org by September 9th, 2024. The course access code is ZOHU Webcast. A captioned video of today's webinar will be posted on our August call page within 30 days. Free CE for the web on-demand video of today's webinar will be available until September 10th, 2026. And the AASBB race credits are available for this call and the previous May and June 2024 ZOHU calls as well. Next slide, please. Before we begin today's presentations, Dominic Cristiano, One Health Office ORISE Fellow, will share some news and updates.
Thanks, Keisha. Hi, everyone. Good afternoon. Thanks for joining our August ZOHU call. Just a note, please remember to share the ZOHU call website link with your colleagues from public health, agriculture, wildlife, plant and environmental health, and any other sectors, so we can let them know about the live webinars, video recordings, and free continuing education that the webinar offers. Before we get started with presentations in a second, I'll just share a few updates and resources. You can find links to these resources in today's ZOHU Call email newsletter. And if you aren't subscribed in the newsletter, feel free to sign up using the link on our main ZOHU Call webpage, and you'll get these ZOHU Call updates moving forward. So to begin, CDC is working closely with USDA and FDA to monitor the current H5N1 bird flu situation in dairy cows, wild birds, and poultry, as well as sporadic infections in other mammals. You can find the latest updates on USDA, FDA, and CDC's websites, including situation updates, recommendations for protective actions for people, confirmed cases in domestic livestock, and more. Next slide. In today's newsletter, we're highlighting several recent publications, including an emerging infectious disease article titled Persistence of Influenza H5N1 and H1N1 Viruses in Unpasteurized Milk on Milking Unit Surfaces, and another titled Archaea in the Human Microbiome and Potential Effects on Human Infectious Disease. Next slide. Additional publications we've highlighted include reported incidents of infections caused by pathogens transmitted commonly through food, impact of increased use of culture-independent diagnostic tests, foodborne diseases active surveillance network 1996 to 2023, and moving beyond wastewater, perspectives on environmental surveillance of infectious diseases for public health action in low resource settings. Next slide. Here we've highlighted announcements and resources, including a CDC press release on dog importation process updates, a new fact sheet on antimicrobial resistance threats in the United States from 2021 to 2022, and USDA's Conservation Effects Assessment Project. Next slide. Some August observances that may be of interest include National Water Quality Month and National Immunization Month, and World Mosquito Day on August 20th. Next slide. And finally, we've shared several new and ongoing outbreak investigations, including a Listeria outbreak linked to meat sliced at delis, and 3 separate Salmonella outbreaks. One's linked to cucumbers, one's linked to pet bearded dragons, and another's linked to backyard poultry. Next slide, if you're able. Thank you. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases. And linked from today's newsletter, you can find details about additional ongoing U.S. outbreaks. Our next ZOHU call is going to take place on September 4th, 2024. And as always, please continue to send presenter and topic suggestions for future presentations, as well as any news from your organization to zohucall@cdc.gov. Next slide, and back over to you, Keisha.
Thank you, Dominic. Okay, so you may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on the slide on the ZOHU Call webpage for today's webinar and in today's email newsletter. Now we can begin our presentations. Next slide, please. Today's presentation, Thinking About Thinking, a metacognitive framework for antimicrobial prescribing by veterinarians, will be presented by Dr. Stephen Cole. Please begin when you're ready.
Hi, thank you so much, Keisha. Thank you everybody for having me today to speak about some work that I've done on actually within veterinary students, but is applicable to veterinarians. And I hope, in the spirit of the One Health call, that there will be collaborators and colleagues in the audience today that are also interested in potentially how this can impact prescribing by other types of antimicrobial prescribers as well. Next slide, please. So today, this is just a quick outline of what we'll be discussing, sort of what is the basis of the metacognitive approach to antimicrobial selection, and then a study that we did looking at a metacognitive framework that we developed at the University of Pennsylvania, and then applied at several veterinary training institutions across the United States. Next slide, please. So when it comes to the ways that we think, really, there are several hypotheses on how information is processed by our brains. But, one of the more predominating theories is that, human brains use 2 types of thinking. Those are thinking fast and thinking slow, for lack of better terms. So when I ask you as the audience to think fast, in this picture here of these 4 chairs on the left here, you should automatically brain probably goes to that red chair on the bottom, right? So next slide, next advance, please. And this is what we call type 1 processing, right? It's non-analytical. It's our gut instinct. It's what feels right to us. However, on the right, we have thinking slow, which it takes your time to problem solve. You think about the steps, right? You think about it step by step by step. This is called, if you advance for me, please, type 2 processing, which is analytical thought, right? This is the sort of thought that is deep and thoughtful and often requires slowing down and thinking about a problem or solution. Next slide, please. Type 1 processing particularly is at risk of being informed by different types of cognitive biases. And we deal with these cognitive biases all day, every day. And certainly veterinarians prescribing antibiotics is not going to be a group that is not influenced by these cognitive biases. So I just have some examples of these here, right? So availability bias, right? So in this case, amoxicillin clavulanic acid worked the last time. So we may go immediately to that drug that worked the last time without any real evidence that that's the drug we should be using, just because we can think of it really easily. Next slide. There's also confirmation bias, right? So metronidazole, the drug in veterinary medicine that has been used for many years as therapy for acute diarrhea, but more and more studies are showing that really that this is not an effective therapy for acute diarrhea, but is still used pretty widely. And when you speak to veterinarians, you can see confirmation bias going on, right? Because the animal gets better on metronidazole, but that animal may have gotten better on its own, but we confirm our belief that we actually had impact by prescribing a particular drug. Next slide. Commission bias, right? So in veterinary medicine, we're in a unique position without really any significant insurance system being available. There certainly is a hefty cost to a client seeing a veterinarian when their pet is sick. And as veterinarians, we think of commission, we have commission bias informing what we do, where we are enabled to act on a need to act, right? So say the cost to the client makes us feel like we have to do something, like prescribe an antibiotic. And then the last one, please, is the illusion of control. This is my personal favorite one, which is that we think that what we do has a much larger impact of what actually the outcome is, right? And so a good example of this is using antibiotics prophylactically during surgery when they might not actually have an impact on our overall surgical rates. And so really having ways to overcome these cognitive biases and switch from type 1 processing to type 2 processing is going to be an important approach for thinking about how to prescribe an antibiotic. Next slide, please. And again, these arise from type 1 processing. Thank you. So metacognitive frameworks are one way that we can help shift that type 1 processing to type 2 processing. Metacognition really is the act of thinking about thinking, right? So this allows us to consciously debias our thinking process, and we can uncouple this process. And so in medicine, a very common metacognitive framework, next advancement, please, is the idea of a SOAP, right? This is something that helps us break down the information in our approach to a patient by the subjective, objective assessment and plan that's used, right? So this is how we can look at what information we have about a patient in the subjective and objective formats. How we assess that information is then laid out, and then we develop a clinical plan associated with that. And so this is a very common metacognitive framework used in clinical medicine. And so we set out to really sort of think about what could be a good metacognitive framework for antimicrobial prescribing. Next slide, please. So we developed at Penn the soda pop method, which helps with a complex medical decision, which is what antibiotic to prescribe, particularly with culture and susceptibility testing reporting, but can also be adapted to empiric prescribing as well. And if we can advance one. The one that I really want to sort of highlight here, so we have soda pop standing for source, organism, decide to treat, patient antimicrobials patient option and plan. And really, this is where a veterinarian or a veterinary student in this case can go through and really think about all the pieces of information that we collect during the assessment of a patient when we prescribe an antibiotic, and apply that information to making a reliable plan for approaching therapy. Next slide. And I do want to highlight sort of the D in here, which is decide to treat. Really, this is that critical step in soda pop, because often infections have resolved, or an infection may not actually be evident, but we can certainly culture bacteria from non-infected sites for sure. And so really a big part of the soda pop process is again, that unconscious decoupling and really asking yourself, should I be treating this? Yes or no? Next slide, please. So we did a study at 5 different veterinary schools across the United States to look at the impact of soda pop on both competency for prescribing and self-efficacy, or the belief in their own ability to do prescribing, veterinary students of antimicrobials. So this is at Washington State with Claire Burbick, Colorado State with Josh Daniels, Ohio State with Dubra Diaz, Campos and Virginia was at Virginia Tech, was Tessa Lecuyer, and then of course myself at Penn. Next slide. So our aims of the study were to develop scoring schemes and cases to assess antimicrobial selection, because you need to be able to score something in order to teach it, right? To be able to give feedback and to be able to rank the quality of a choice, and then ultimately to determine the impact of the soda pop framework. Next slide, please. So one of our first steps was really to actually develop a rubric. I don't have time to go through it here, but we developed 2 rubrics that are available now publicly. And you can reach out to me if you'd like copies of these. And they're also published in our paper in the Journal of Veterinary Medical Education, that looks at both scoring both the choice of the antimicrobial, right? What was the choice that the individual made with regards to what other antimicrobial choices were available, and then what was the plan, right? So how complete was that plan itself? Next slide. Aim 2 was also part of this was to develop a set of standardized cases. We were able to validate 5 of these cases for availability. So another great outcome of this project is we now have 5 validated cases that fit with the soda pop framework for teaching in veterinary classrooms as well. And so this is just an outline of those cases. We did both urinary tract and skin infections, 2 of the most common types of infections we see in veterinary medicine. Next slide, please. So this is just an outline of the study. It was the 5 veterinary schools, and we had both a control group who received an antimicrobial selection video that did not include soda pop, and an experimental group that did. They completed cases before and after for competency, and they also completed a survey before and after asking questions about their self-efficacy or their own belief in whether or not they can choose an antimicrobial. They also received an incentive of a $20 gift card for this study. Next slide. So this slide is just to show that once we divided the 2 groups into their separate experimental and control groups, there was no difference between the 2 groups demographically. Next slide. And when we looked at actually the competence scores with our hardly developed rubrics and cases, we actually did not see a big change between the 2 groups. Now, we just showed a video, right? And the study wasn't able to contrast the long-term impacts of soda pop on prescribers or potential or future prescribers, but we did not see a significant difference between the competence scores per se. However, the students did report that they did feel like it was a helpful tool. However, next slide, please. When we looked at self-efficacy, and this work was really headed up by Tessa Lecuyer for validating a survey for self-efficacy in veterinarians and prescribing antibiotics. We asked questions about empiric prescribing, culture and sensitivity prescribing, and recommending treatment protocols that reduce antimicrobial use. So next slide. So this is where we did see some differences between the groups. So next animation, please. In what we actually did see is between the two groups, even though demographically they were similar, we did actually see a difference in competence, or excuse me, in self-efficacy when it came to first-line antimicrobial therapy prescribing, empiric choices between the two groups. However, afterwards, after we did the intervention, next animation, that disappeared, that significant difference. So that shows us that at least if a group of students is behind that soda pop can help catch them up to their peers when it comes to self-efficacy. And then next animation, please. Next one. And then we also found a significant difference between the pre and post scores of increasing in self-efficacy, but only for that soda pop group. So it was also perceived potentially by the students as a tool to help them gain that belief that they are able to prescribe appropriately. Next animation, the next one. We also saw a very similar story again when it came to recommending treatment protocols that reduce the use of antimicrobials. Next animation. And then the next one. And then this is a funny little, this was not part of the original goal of the study, but what we did show is that students were less self-efficacious when we showed them antimicrobial susceptibility, culture and susceptibility reports. Both groups actually significantly felt less confident in interpreting culture and susceptibility reports. So we did show that when students first think they can do it, they actually later, once you show them it, realize that they actually can't. So at a bare minimum, we showed that asking students to interpret susceptibility results helps them realize that it's not as clear cut as it always is. They may think it is. All right, next slide. So in conclusion, we developed 5 cases and 2 validated rubrics for the soda pop study. Soda pop may help to raise student self-efficacy and antimicrobial selection. And while it did not immediately improve competency, we know in education that iteration and repetition is really, really important. So it's likely required before this would have a significant impact on competence. And students mostly in general liked soda pop, about 75%. Did say they liked this as a learning tool, but only a quarter could actually recall the entire mnemonic on the follow-up survey. So again, we do think that iteration and repetition is a really important aspect of this all. So I just, with the last slide, please, want to acknowledge the funding source. So this work was supported by a grant mechanism of a capacity grant through the Veterinary Laboratory Investigation and Response Network, or VetLearn, who's sponsored so far 7 different grants across veterinary laboratories across the United States to really target and improve veterinary antimicrobial stewardship. And so there's some work here. I actually saw that Dr. Kukanich, the paper that's on that top left, I saw that she's on the call today. This is some awesome work that they've done on frameworks for reporting of multi-drug resistant bacteria in veterinary settings, as well as some great work that they've done on education materials for clients on antibiotic resistant bacteria. They're on the right. And at the bottom is a website. In my other part of my life, I study carbapenem resistant antibacterials in companion animals. And this is a resource website that VetLearn has also supported to help build veterinary antimicrobial stewardship. So I just wanted to acknowledge this fantastic mechanism and support that veterinary labs get through the FDA, and just acknowledge them and thank them for this opportunity for those of us in the field. And hopefully it will have a great long-term impact on veterinary antimicrobial stewardship as well. We'll just go to that last slide, and these are just the rest of my acknowledgements. And I just want to thank again all my collaborators and all those people that support me in the work that I do. Thank you very much.
Thank you so much for sharing this presentation, Dr. Cole. Next slide, please. Our next presentation, NOAA and One Health, Marine Animal Health, Environmental Intelligence, and Heat Resilience, will be shared by Alice Lau and Julie Turton. Please begin when you're ready.
All right. First, so I'm Julie Turton, and I just want to thank you all for the opportunity to be here and speaking with you. Now for something a little bit different, we went from a micro scale to a macro scale. So I am with the National Oceanic and Atmospheric Administration, and you might wonder what the heck we're doing here, but we actually have a lot to do with what you do. It's just the intersections are not always obvious. So NOAA's mission is basically to understand and predict changes in the Earth system, share that knowledge, and we have a stewardship role in conservation and managing coastal ecosystems and marine resources. So science, service, and stewardship is our thing, and health actually cuts across every single element of what we do at NOAA in one way, shape, or form. Next slide, please. So the other part of what we do is, as I said, we're the forecast folks. That means we observe a lot of things and we predict a lot of things. We have the weather service as a part of NOAA. And so the forecast tools that we have span time scales from, like a heat forecast right now to long-term projections. And the levels of certainty change and the like. But I wanted to put this slide up. This in and of itself could be a whole talk, but I would ask that you think about how you might manage the resource or the health risk that you're responsible for using environmental information in a different way than maybe you've thought about it before. And if you can't do it yet, what research is required to actually make that happen? Because with our ability to predict some things, it doesn't make sense that we are caught off guard as often as we are in this day and age with some of these environmentally related health risks that we could do a better job of anticipating. So that's our mission here, is to really help integrate the environmental information into how we manage our health risks and reduce them and maybe even prevent them. Next slide, please. So we do that by observing the Earth system, doing the forecasts, and this means everything from satellites to buoys in the ocean and observational systems that are on the ground, next to you in your neighborhood, at your airport, that sort of thing. Next slide. And the other part is that the forecasts that are made require a massive observing network, both atmospheric and oceanic. This is just an example of all the ocean observing systems that we have that go into making the products that we do. But they can also probably be used directly for some of the health risks, especially for the marine animal and coastal side that you're going to hear about a little bit later from Alice. But these forecasts are used to make a heat forecast. It takes an ocean-going vessel in the middle of the sea to actually provide information that makes that heat forecast that tells you whether you can go safely out or how to manage your animal populations. All right, next slide, please. So in order to really consolidate within NOAA our contributions to the health sector and our engagement with the health community at large, we have a One Health program approach. It's not a dedicated line, but we have 6 different line offices across the agency, and this One Health group allows us to coordinate both internally and to more usefully engage externally to make sure that our science and services deliver actionable science, effective services, and enhanced stewardship that help protect health. That's basically what we're doing here, is talking to you about that. So you can see the areas around that circle are all of the working groups that we have within NOAA. The one that might be of interest to you that you wouldn't be thinking is the benefits of the sea, but in particular, some of the changes in ecological systems affecting rainfall and temperature, they change patterns of disease distribution, of human migration, of human interactions with disease vectors, of water quality, all kinds of things. So just thinking about how the environmental information can be used in a more innovative way to help you with your job and function a little bit more proactively. I would love to leave here with a list of that, or at least pique your interest in it. Okay, next slide. I'm going to talk to you a little bit about one of our priority areas, which is heat. And I don't think it comes as a surprise to anybody on this call that we have had a lot of heat waves. We are having an increased baseline of heat, hotter years, hotter days, longer heat waves, higher nighttime temperatures, all kinds of things. And they have impacts in our society, our ecosystems, our animal health, our human health, and even things like food supply, food chains, that sort of thing. There are cascading impacts that we really are working very hard as a federal government to manage. But honestly, it's a team effort, and we're coming out soon, next week actually, with the National Heat Strategy. but it is called a national strategy because we know very well that what we do on the federal side absolutely has to be closely tied to state, local, tribal governments and nonprofits, and sort of it's a whole of country approach to managing heat risk, not a whole of government approach alone. So if you go to the next slide, the impacts of heat are, as I mentioned, agricultural, so that has a direct impact, and certainly in combination with drought and wildfires, there's an impact there. But there's a direct effect on human health and morbidity, and then there's an economic impact also with labor force productivity for the workers themselves, as well as the environments in which they work and what that does to our economy. So whether you're looking at human health, agricultural production, including animals and livestock, or economic production, heat has a pretty devastating impact across the board here. Next slide, please. So I'm going to do a little bit of why heat matters and the cascading impact. So just thinking about some of the things, like we're looking at avian influenza, for instance, there are some connections there with the ecosystem changes that are happening in the marine environment, but it also affects changes at borders and how people move and who they come in contact with. It changes the mosquitoes and where they live and how they interact. And even after hurricanes, what happens after a hurricane followed by a heat wave? Well, where have we heard that before? Just like last week or two. So these cascading impacts are exacerbated by heat. And so I'm just going to pause for a second and say, think about that all the way from how you live your life, what you're doing in your own work, if you are even a first responder or responsible for them, all the way to long-term planning for your community of service or for your own community. So the cascading impacts of heat are almost as complicated and dramatic as the direct impacts of heat that we well understand. Next slide, please. So in order to, one more, sorry. In order to actually, I'll keep going. Those were the pictures. I meant to say that, sorry. So in order to manage heat risk, there are now 28 federal agencies that have come together to be a part of what's called the National Integrated Heat Health Information System. It was launched in 2015 by NOAA and CDC and fully amplified by this administration's White House and focus on heat. We now have, as I mentioned, 28 federal agencies involved in managing heat risk. We have a national heat strategy coming out soon and a lot of other activities that I would really love to share with you. We are across time scale, across agency, and one of the main messages here is that we have resources that we are working with to make sure they help not just the federal family, but the national family. And there are a series of engagements and activities that are happening that we would very much like to continue after this call with those of you who are interested. So it's an ask at the end. We will have some emails. And if you're interested in working with us on heat, we'll be doing an after heat season larger community, sort of what happened with heat and how do we prepare for the next heat season. We'll be doing that in November. So just this is a very active group, and we would like to make sure that we have the right participation from members here in the One Health community. All right, next slide. I'm going to switch just a little bit to a few things that NOAA has been doing. So NOAA actually houses the Interagency Coordination Unit for NIHIS, but it is led by NOAA, Health and Human Services, and FEMA, and like I said, 28 other agencies. So we have the coordination function, but we also have some work that we're doing on our own. And I'm putting this up here because we were asked to talk about heat, and also this might have some connections and might be able to do it in a slightly different way with more of a health focus. But we've been doing urban heat island mapping campaigns. We'll be doing over 80 communities by the end of this summer. And it is a very active citizen science kind of effort that is led by a community. We ask for short applications. It's a grant, but it's not a complicated grant. And they actually mobilize volunteers to map the heat risk in a community. And then the information goes back to them. And that has been used to do things like tree planting campaigns or figuring out where to put sails or cooling implements near bus stops, or Houston made a whole heat resilience plan, so all the way from planning to actual responses and implementing solutions to heat. but we don't actually have a very strong, animal component to this, or we aren't really looking at the infectious disease impact or how that affects people who are at greater risk because of medication. So we haven't been able to get to that level of detail yet, although we know it's important. So if you go to the next slide, the part that we are doing, though, very well is bringing parts of communities together that don't normally talk, because it isn't just an emergency response and it's not just a public health response. We have started doing these tabletop exercises that bring different components, the transportation, the energy folks, the first responders, the city planners, and all public relations people to the table to do these tabletop exercises. And actually, I'm pleased to say that sometime next week, we're going to be announcing a challenge for communities to build their own process, their situation, like what was the exercise you'd like to do, and then we'll award 10 communities some funding to actually go do a tabletop and do some planning with that. So the tabletops are an interesting way to go, but they have been focused more on urban heat, and I think there's some real possibilities to work together on more of the One Health approach with that. And if you'll go to the next slide, and then so the other piece that I'll say, maybe not quite as much, but there is a maturity model that will help communities figure out where to start in the process. So if you don't have a chief heat resilience officer, which in fact there's only 2 or 3 in the entire country, where do you start? Where do you go? What kind of partnerships do you need? So that is a tool that's available. The tabletop exercise guide is available for folks, but the challenge is coming out to help communities and get organized to actually use them and implement them. So those are 2 resources that are available for heat. And then if you do the last one, for me, I believe, maybe one more after that, but we just announced 2 centers of excellence, one for heat monitoring and one for heat resilience, more on the policy side. One is really working with museums of science around the country, and there will be regional hubs for monitoring. And then the policy one is obviously focused more on governance and policy issues, but each of those centers will be doing at least 10 communities a year, 30 total. Those are funded with Inflation Reduction Act money, so we hope that they will continue after the 3 years, but we are very excited to have them as a basis for how we begin to work together more systematically. And I think the last, why don't we just skip over, well, go to the next slide, please. This is the kind of information that is out there, and each one of these I could explain in more completely if that were the point. The point is to say we have information that has heat outlooks that goes from, the heat work that goes out to the, like a current warning. We have a new product called Heat Risk that puts information out that's health-based, and it goes out to 7 days. We've got early warning bulletins for around the world. We've got hazard outlooks that we support around the world, and we have partnerships globally working on heat in its many aspects, including One Health. And if you go to the last slide, for me, it's the partnerships on the international front. I want to just put the names in front of you. There's a lot of information that could be unpacked in each of these, but we are very active partners in the Global Heat Health Information Network. And I don't know if you caught it, but I believe it was just last week, the 25th, whenever that was, the UN Secretary General announced a big call to action on heat, and many of us were a part of that. There's another thing called the Group on Earth Observations that is building a global heat resilience service. And all of these have a health component to them. So if you don't know what they are, we need to be connecting with you better. So now I'm going to turn it over to Alice to talk a little bit more about some of the marine and coastal side, because her own background is in marine animal health, and she is our new One Health coordinator at NOAA. We are really happy to have her. So Alice, over to you.
Thank you, Julie. Hi, everyone. I'll be covering the heat impacts of marine animal health for the following presentation. So next slide, please. So NOAA's unique contribution of legal authority, regulatory responsibilities, and scientific expertise makes us the primary U.S. government agency responsible for marine ecosystem health. So demonstrated by this visual infographic, heat is truly a pressing One Health issue with its severe, overarching, and cascading impacts across the human health, animal health, and environmental health domains. Next slide, please. So NOAA plays a key role in water quality and coastal science through research, monitoring, and forecasting several health threats such as high nutrient levels, pollutant concentrations, harmful algal blooms, waterborne pathogens, and other factors impacting habitat health and ecosystem dynamics. The agency's role in environmental monitoring, prediction tools, and multidisciplinary expertise also enhances coastal resilience and promotes biodiversity by protecting critical coastal habitats such as coral reefs, estuaries, and wetlands. We as an agency are also heavily involved in mitigating heat-impacted environmental changes and coastal hazards such as storm surges, flooding, erosion, and extreme weather events. Next slide, please. Thank you. As demonstrated by this slide, NOAA also has a key role and leading role in sustainable seafood practices. So NOAA plays a pivotal role in promoting sustainable seafood through scientific research, standardized regulations, education, and international collaboration. By ensuring that seafood is harvested responsibly and sustainably, the agency helps protect marine ecosystems, support coastal communities, and provide consumers and the public with healthy, sustainable seafood choices and options. Next slide, please. With NOAA, we are, I believe, heavily known for our marine ecosystem health initiatives, but in particular, marine animal health. So NOAA leads marine mammal health research through stranding response programs, biotelemetry, and disease surveillance to study and track diseases, environmental factors, and ecological dynamics such as heat impacting marine wildlife populations. NOAA is heavily involved in the policy space to implement conservation management measures to protect threatened and endangered marine species, restore crucial habitats as shown by this coral reef in the image, and to minimize human impacts and disturbances. Next slide, please. So a good issue to address is, for example, heat waves in the water. Typically, when people think of heat waves, there is often a terrestrial focus. And while that is definitely important, I think it's also good to highlight and crucial to highlight how heat impacts marine ecosystems and in general aquatic ecosystems. So with a marine heat wave being a period of unusually high ocean temperatures defined by its unusually high and strong duration and intensity, the event in September 2023, I feel like is a really important example of why One Health is important. So in September 2023, there was the death of over 150 Amazon River dolphins in Brazil's Lake Tefé, and this led to devastating environmental, ecological, and economic impacts. So NOAA as an agency, we are working towards addressing these knowledge gaps between heat and health impacts on marine ecosystems. And I believe that highlighting marine heat waves and health can be a great way to connect to the public with this pressing One Health issue. Next slide, please. Heat can also have several environmental and ecological and also economic impacts through several environmental phenomena. So for one example, harmful algal blooms. Harmful algal blooms from forming cyanobacteria typically thrive in warm, slow-moving water, and this usually occurs when water temperatures are warmer. So from heat and, for example, climate change, increases in water temperature are expected to increase not only the magnitude, but also the duration of harmful algal blooms, and this can have devastating impacts on water quality, animal health, and human safety. Next slide, please. To effectively address our role as an agency, NOAA has the operational modeling and ecological modeling expertise. The line offices across NOAA have the expertise for pressing One Health issues that are not only in the nation, but also occur worldwide. So for example, Vibrio bacteria, as demonstrated by this infographic on the left, it causes an estimated 80,000 cases of illnesses in the US annually, and this is projected to increase in Alaskan waters with warming temperatures. Many of these illnesses are associated with consumption of raw shellfish, and this can lead to an economic burden for the seafood industry and coastal communities that are also heavily dependent on not just shellfish, but also seafood for their livelihoods. So addressing this, the impact of food security and food safety, this can have truly large scale and also in general, this can have large scale impacts for their livelihoods and overall environmental conditions. Next, please. Thank you. So to address thermal stress, I believe two factors I'd first like to introduce are habitat degradation and slow recovery. Heat significantly impacts marine biodiversity and can lead to habitat degradation for critical habitats such as coral reefs, seagrasses, mangroves, and kelp forests. And these incredibly diverse, rich, and beautiful ecosystems, through a combination of direct thermal stress, altered species interactions, and changes in the physical and chemical environment for the oceans, can lead to severe irreversible changes. With how complex, interconnected, and multi-layered the marine ecosystem is, heat and thermal stress requires years and even decades for recovery for these ecosystems. And even then, the habitats and ecosystems will never return to their original states. Next slide, please. To address this in the broader scale, heat and health impacts are truly interconnected and often exacerbate each other, which can result in profound and lasting changes to marine ecosystems that we, even in the present, sometimes may not be able to predict. So, for example, we as an agency for NOAA, we utilize several different skill sets and platforms such as remote sensing, modeling, and in situ data to operate tools and develop decision support systems to help several key stakeholders such as resource managers, scientific researchers, decision makers, in-water monitoring networks around the world to prepare for and respond to marine ecosystem stressors, predominantly resulting from climate change and warming of the Earth's oceans. Next slide, please. Thank you. To address this, another big impact that I feel like is important to address that it may not be typically known to the public are the behavioral changes as seen with marine animal health. Migration shifts and altered reproductive cycles, while it may not be as obvious compared to, for example, a dried up ocean, they can truly lead to severe long-term impacts. So from species distributions, ecological dynamics, and human interactions, there are these severe irreversible consequences and impacts on the marine animal population health from heat impacts. So as demonstrated by the visual in the bottom left corner, some fish species are shrinking, probably highly likely due to global heating. Next slide, please. And as demonstrated by the infographic, but also by the diseases on the right, biodiversity loss is a huge consequence, and this can lead to increased disease susceptibility and food web disruption. So habitat degradation leads to marine animal health population declines, impacts fisheries and food securities for communities that depend on them for their marine resources. Degraded habitats from collapsed ecosystems such as what we previously addressed with coral reefs, kelp forests, mangroves, and also even beaches. They're less effective at protecting our coastlines from erosion and storm surges. So in the grand scheme of things, with disrupted biodiversity due to heat, this can increase our vulnerability to climate change impacts. Next slide, please. So with closing thoughts, I think I'd like to share just with everyone here today that NOAA has a unique, ever-evolving role in the global One Health framework as the nation's leader in oceanographic, meteorological, and atmospheric predictive sciences. We are at the forefront of marine ecosystem health efforts and environmental intelligence initiatives, and I feel like that is truly a unique role that we have within the government, but also within the One Health community. One Health can promote collaborative public health interventions, integrated monitoring, and sustainable solutions to mitigate the heat impacts on human, marine animal, and environmental health. NOAA is highly driven and interested to collaborate on One Health issues such as highly pathogenic avian influenza, HPAI, disease modeling and forecasting, heat impacts, and integrating environmental information for health planning and preparedness and more. So I'd like to say thank you all for listening to this presentation and joining us today. And before that, I'd want to ask Julie if she has any closing thoughts from her end.
No, just you've done that already. I just would hope that actually, I think we didn't somehow end up with our contact information at the end, but I hope that we can share that and check out One Health at NOAA and heat.gov if you're interested, and email NIHIS, NIHHIS at NOAA.gov. Sorry, I had to think about that if you're interested in working with us. So thank you, Alice. You did a great job. And thank you all for being here and listening.
Thank you, Julie. Thank you, everyone.
Thank you so much, Alice and Julie. If you'd like, I can open up the chat for you guys to insert your contact information, and I will do that now. If one of you would like to write out in the chat to everyone that I think you shared a website and maybe an email again. So yeah, feel free to go ahead and do that.
Thank you.
No problem. And so we have time for a few questions. But again, thanks again for your presentation, sharing about NOAA and One Health. And thank you again, Dr. Cole. So as a reminder to our attendees, if you have questions, please use the Q&A feature in Zoom to send your questions and include the presenter's name or topic. Okay, so we will start with questions. And for Dr. Cole, how do you think the results would have differed if the subjects had been practicing veterinarians as opposed to vet students?
Yeah, that's such a great question. Obviously this is going to be some speculation. I'm actually currently in some talks about maybe trying to do this study with, you know, real life grown up veterinarians. I guess my instinct is that, and a lot of the studies out there show that the more you do something, the more you become firm and set in your ways, right? And so, uh, I think when we have students, we have particularly our most malleable and most changeable audience. So I do, wonder how much, we can really change this prescribing. That being said, I think there's a bit more of an extrinsic motivation once you're actually, seeing patients and wanting to make better choices for your patients. And so, it's a little hard to predict. I suspect that, veterinarians in general feel fairly confident and self-efficacious in their ability to prescribe antimicrobials. Um, However, I wonder if some of that would actually decrease if they're exposed to some of the newer thoughts of thinking when it comes to how we prescribe antibiotics in veterinary medicine. And so that's part of this sort of intervention as well. So I'd be curious to see if we did see a positive impact, or maybe potentially, we made them a little bit sort of like with the students and the culture and susceptibility results. Do we make people a bit more aware of their where they're not as strong by simply implementing the study? So I wonder if we would have seen that there. I also do think that there's probably a bit more room for growth once you've set into bad habits and you're not being reminded about this on a day-to-day basis like the vet students are in vet school. So maybe we could see some change in competence as well.
Great, thank you so much. Okay, so looking back at the questions, for Dr. Cole, I think I see one that just came in, but just wanted to mention that we have an attendee that wrote great presentation and enjoyed the work presented. So just wanted to shout you out there.
Thanks, Pat. Good to hear from you. Hope you're doing well.
And then we have another one for you, Dr. Cole. So I'm going to read this. The AMR metacognitive framework appeared to be focused on students entering companion animal practice. Is there a plan to apply the framework to food, animal, and production practice and dynamics related to herd health, disease control, and prevention?
Yeah, thank you so much for that question. It's a fantastic question too. It's certainly in the list of things that I would like to do with the framework. I certainly would, take developing new cases. And I also think, the soda pop framework, certainly needs a bit more room for looking at the legality of use, right? The requirements of legal use of drugs in those animal species as well. So it's certainly been on my, sort of next steps for the project itself. I certainly am interested in that application. I think there are certainly a lot more drugs that companion animal veterinarians pick from compared to production animal veterinarians. And so that is certainly another sort of aspect that needs to be considered when we move forward with it. But I think it's a really excellent move forward and how we can do it. Or maybe it just requires taking the same approach of a metacognitive framework, but tailoring it to that specific type of practice.
Great, thank you. We will move on to a couple questions for our second presentation, and in particular for Alice, in regard to heat mapping and citizen science, is Alaska involved?
Thank you. We did address how, yes, there are, as of now, like over 80 communities involved nationwide with heat mapping efforts. With Alaska, I'm not fully certain I don't think so, but Julie, would you be able to provide a bit more context and
Yeah.
information about that?
So the answer is no, but only because we haven't received an application or it wasn't a successful one. They are reviewed and they have to, meet a few minimal criteria, like you have to have a problem, which obviously Alaska does. You have to be able to mobilize your community and then demonstrate that you can use the information somehow. So actually would love to be working a little bit more in Alaska. So if you're interested, with our new centers too, we might be able to work that a bit more. We did work in Hawaii, so we're not opposed to that. And in some of the territories too, we've just done a tabletop in Puerto Rico. But no, the answer is Alaska, we have not done. But we do have a very active NOAA presence in Alaska and are very involved in the One Health network up there, Leo network, I believe. So yeah, happy to follow up. But no, we haven't done it yet. Love to.
Okay, great. Thank you. And then another one for NOAA, and also just wanted to mention that they checked the chat. They did share some information and websites in the chat that they referred to. So for our next question and possibly our last question, could our NOAA colleagues comment on the variability in marine mammal heat stress impacts within U.S. waters, given the differential ability of certain marine mammals and habitats to cope with heat stress? I.e., how do the impacts vary in Puerto Rico, U.S. Virgin Islands from Alaska, from the Pacific Islands?
That is a tough question. I'll start, and then Alice has a background specifically in marine mammal veterinary herself. But I know even we have a whole marine genomics program too that works closely with some of this, and the impacts are different. Their adaptability is different. So we are concerned about how both the direct temperature in the water and the consequences of ecosystem change in the water affect the stress levels and the ability to cope. But we're seeing that unusual mortality event die-offs. Alice, I'll turn it over to you for a few more specifics on that I know you have in your pocket. But it's hard to generalize because animals, just like humans, as you know, have different physiologies and they are adaptable in different ways. So it's hard to generalize quite to that scale. The general thing is we're actually quite worried about marine heat waves and the changes in heat in the marine environment, but the reality is that the implications are very different sub-regionally. Alice, I know you've got some die-off information at your fingertips if you'd like to speak to that.
Thank you, Julie. Yes, that's a great question. It's a very nuanced and complex question with a lot of layers, but one thing I would like to address is regarding marine mammal heat stress impacts. I feel like it's not just it's population dependent, but it's also location dependent. So for example, depending on the location, sometimes the population health impacts that could depend on the genetic diversity due to the history of certain situations or just for certain populations, like their response to heat stress, but also other ecological stressors may vary depending on higher genetic diversity versus lower genetic diversity. So even with marine mammal mass die-offs, depending on the genetic diversity and how resilient they are, that could also lead to the different patterns or dynamics with certain heat stress impacts. Another thing could be also how it's location dependent. So sometimes due to, for example, heat, but also other environmental and ecological stressors, sometimes there may be, for example, pathogens and new strains that have never occurred before in a certain location, and it'll be a bit unexpected. So for example, one thing we could address is from NOAA's end is like Vibrios. So with Vibrios, typically we have seen them across like various locations, but it could reflect and introduce a different side to the issue when there is a Vibrio strain that has never been in an area before and it's newly introduced, and that could have far-reaching implications both ecologically, environmentally, but also economically, because a lot of the times if it's introduced for the first time, each strain is different, the response is different, so we really won't be able to fully have like a one-size-fits-all solution. So that's something I'd like to address. So regarding with Puerto Rico versus Alaska, like the environmental conditions are really different, but also the ecological conditions are really different. Sorry if that was very long, but hopefully that could help address some factors to consider.
And Sam, I didn't realize that was from you till I was looking. So thank you. Really good answer, Alice. And Lars, the Alaska Native Tribal Health Consortium, hopefully is connected with NOAA, but if not, let's fix that, because I've had interactions periodically, but let's make sure we are connected on that.
Awesome. Thank you so much again, and can't thank our presenters enough for sharing all this amazing information. Next slide, please. So a captioned video will be posted within 30 days of this call, and please join us for the next ZOHU call on September 4th, 2024. Thank you for your participation, and this will end today's webinar. Thank you.
Thank you.